All right. Welcome, everyone. As people are joining in, I ask you to mute yourself so that any background noise isn't interrupting the speaker, who will be my husband. Um, I'm excited that you all could join, and I know folks are still entering the room, so we'll just do our usual housekeeping items. So I am recording this session and we will post it on the YouTube site where I have our previous sessions for those who are new. We've been doing these seminars now for the last year. They were face-to-face, and then due to COVID, they've come in via Zoom, but I have to admit that I think we may maintain the Zoom activity for a little while to come. And so I'm glad we can meet in this forum and have a higher attendance. Also, you may feel better about your privacy, or during flu season, we did do a seminar and people were concerned about their flu risks last year. So I think those are all very valid and reasonable, and Zoom is a great venue for us. So in order to address all of your questions, instead of using the unmute button, I invite everyone to enter questions in the chat box. I think somebody just joined who is not muted, so I'll try to do that while I can. And so I had received an email request before we start on the irregular bowels to discuss COVID, just a brief update as of today. I think the two biggest topics on everybody's minds are how long are we going to be wearing these masks, and what works, what doesn't work. And then the next one is a vaccine, and what's that going to look like. So in the next 3 minutes, we'll talk about that. So I just threw this picture up here. This was last week in line at Whole Foods, the first time I had been to Whole Foods in 6 months. And this gentleman has his mask somewhere on his body, but it's the bandana, and there's his nose very visible. And I looked at him and I'm like, why bother? Number one, bandanas are very loosely woven and they are highly ineffective. And this can explain why it would be ineffective. Even if somebody was talking to you and the virus lands on the front of that bandana, he's just got a direct conduit to inhale it. So lots of reasons not to wear the bandana. We've also learned that if you have somebody with COVID, they cough or they sing or talk or laugh, you can get a 10 to 12 feet dispersion of the virus. The dose and duration, as always, the more close you are to somebody who has the virus and then they're talking to you and it's the longer time, over 15 minutes, are your increased risk. Paper is the best, and I think for a lot of reasons. Paper is a good filter. The virus doesn't survive very well on cardboard or paper, and but it does like moisture, like most viruses. So if you have paper masks, they are also disposable. Remove them from your ear, peel it away from the front of you, and dispose it. Never touch the front of your mask, because then you touch other things and then you forgot what you touched, and then that may then enter your nose and face. I do think that our masks will be with us in some form for about a year until we've got adequate vaccination, and then we know if it even works. And as you can see, in many countries that have survived SARS as well as MERS, many people don't feel confident letting their masks go. Regarding the vaccine, we will likely see something released by December, January timeframe. Just an FYI, all the vaccines by the BARDA contract from the government, and there were many that the government paid a lot of money for, they started making the vaccine at the same time they discovered their vaccine candidate and started their clinical trials, and in the hope that those vaccines would be effective. And so there's like a lot of vaccine. AstraZeneca's got their 100 million doses, and they've got them ready to go. Now they're waiting for the clinical trials to prove that they will be effective. So sometimes we, unlike prior years where we wait to prove efficacy and then start making the batches of vaccine, these guys started making the vaccine at the same time that they were starting their clinical trials. The priority group will be essential workers, healthcare workers first, folks who work in nursing homes, nursing home patients, hospitalized patients, and then different priority groups. In the definition of essential workers is still being debated through our literature. Farmers versus security guards, so those are something to be considered. Remember, many of the vaccines will take 2 doses. So if they say that they have 100 million doses, really that's 50 million people can get vaccinated. The current distribution plan is via the CDC through either the states or both the states and a distributor. We commonly are contracted with McKesson, and McKesson has received a huge contract from the government to supply vaccines. So we would put our names as practitioners through a list with the CDC, and then they would determine our priority in receiving it. Right now, they want to see that sites and physicians or practices can vaccinate thousands of people, because they really want to send it to folks who can just line thousands of people up. I'm sure our hospital system will take care of us. For anybody still interested in participating in a clinical trial, this is a good phone number to use. They are a clearinghouse for a bunch of different vaccine trials. I am part of the Moderna study. I got my either placebo or vaccine a couple of weeks ago. And and it went well. I barely had any side effects, so I don't know if I received a placebo or perhaps the vaccine. The site was just a little warm and maybe I had a slight headache, but that's about it. So if anybody's interested, call this phone number. I received a call last week asking me to participate in another COVID vaccine trial. They didn't really know that I'd already signed up for the Moderna, so they are actively recruiting. Mask Fit is in the chat, and that is an important concept. You want to make sure your mask covers your nose and your mouth, and it's not like too low, so that your respiratory exhalation isn't dispersed. And your air, somebody with COVID can disperse around their masks. But most people who have active COVID have been medically advised to quarantine. So, and somebody said long-term side effects of the vaccines, and will all of the vaccines be the same? So there's three vaccine studies going on right now. And so there are 3 vaccines going on right now. One is and messenger RNA, where you are injected with a lab-made RNA, like a duplicate of the virus that makes the spike protein. And if you remember from our coronavirus lecture, the spike protein is what gives it the corona. There are these little spikes outside the virus that look like a crown. So then that vaccine enters us, we make those little spikes, and then we create our own antibody to that spike. The AstraZeneca vaccine, which was put on hold in the UK due to a couple of patients with neurologic side effects, one with transverse myelitis and the other one with multiple sclerosis, but they reviewed all of the data. The patient who last week was admitted with the transverse myelitis was discharged yesterday from hospital, doing well. they are proceeding with the study and they feel that it's not related. That one is using a chimpanzee adenovirus. So it's a virus that is in the common cold. And the vaccine, the messenger or the RNA or the spike protein is attached to that adenovirus and then given to us in an injection form. And then we develop our antibodies to that. The question is, what are the long-term side effects? And one of the important side effects that we should think about is, will that augment our cytokine storm if we're primed in our immune system and then COVID enters us and then we get a cytokine storm or release? And that is a concern. We are looking for it. The studies are going to be 2 years in observation. My suspicion is that if we think about H1N1 in 1918 and how many young people died with that, but then the virus, we have developed some type of herd immunity and then some mutation and a weakening of the virus. I'm hopeful that something like that will happen as with other coronaviruses. Because as you know, we have many strains of coronaviruses that are part of our common cold. My hope is that that's what's going to happen, and that by being immunized, it'll be just like the flu shot, where it attenuates the experience, but it may not eliminate the fact that we have this virus. So that's why I'm saying masks will still be with us, because just like influenza, it circulates, we can get the flu shot, but we can still get the flu. It doesn't stop the virus from entering our respiratory tract and creating an inflammatory response. So I hope that answers that question. But I know a lot of people are here excited to hear about the GI tract. We can always talk about COVID anytime you like. But I'm really honored that my husband is taking the time to be with us today. I'd like to introduce you now to Dr. Christopher Devereaux. He's in private practice at North County Gastroenterology.
And I'm going to take over. As GI doctors do, we like to talk, especially about poop. First thing is I'd like to start by telling you why you want to listen to me. Obviously, being married to your concierge physician is a good reason, but actually I have some credentials behind it. I finished undergrad at UCLA, went to the University of Chicago for my medical training, and then came out here to California and did residency in internal medicine and gastroenterology fellowship at the Navy. And then I took on a teaching position where I taught at the Navy and UCSD, did advanced endoscopy there, and did a lot of research in inflammatory bowel disease, celiac sprue, and for the last 20 years have been in private practice in the North County. The idea here today, though, is obviously I've got the background, but what I'd like to do is give you essentially a user's guide for your bowels. There's a lot of talk across the internet. Physicians, they often speak a lot in terms of statistics. They have opinions. The principle today, the thing I want to give to you is just generally what should be a good bowel and how to feel good about your bowel movements. Again, favorite topic for us in my field. The very first slide here just shows you a general picture of the anatomy of the GI tract. Everybody understands stomach, small bowel, colon. But the idea you got to understand is when you think of your bowels, remember, all we are is plumbing. The colon is your drain, and everything above it uses the common drain, just like your kitchen and your sink. And really, your digestion is your kitchen sink. So you have your common drain, and then you have the things attached to it, your dishwasher and your garbage disposal and such. So we sort of think of your gallbladder as your garbage disposal, your pancreas as your dishwasher. Anything that clogs up your common drain is going to back up into everything. Your sink, giving you heartburn, your pancreas, maybe giving you some pancreatic irritability, make your gallbladder slow, give you stones and clog up that. So the idea is you want to keep flow through the whole system. And that's going to be the principle about what we're talking about. I'm not going to throw, again, a lot of statistics. I'm going to talk to you basically what to do, how to feel good, how to move your bowels. And so you'll have to also put up with a lot of GI humor, because that's just the nature of who we are when we talk about these things, because we find it very funny. So the first thing, what is normal? Normal, everybody asks that. First question, what is normal? Well, normal for the young is not anything like normal for the old. When we get older, obviously our bowels do their own thing. The key thing to remember is going is not always the goal. The idea is you may have something come out, but if you didn't finish the job, it's not a good bowel movement. So people come and say, I go every day. Yeah, a couple of pebbles, that's not a bowel movement. A bowel movement is when you feel empty, if you feel good, that's what we're aiming for. And constipation doesn't mean, hey, I didn't go today. Constipation doesn't mean I had a hard stool. Constipation can be, I went 6 times and every single one of them was formed and I never got empty. Or I had to strain just to get the poop out. I had soft poop, but I had to work so hard to get it out, it was not fun. After a bowel movement, you should feel good. And that's the idea. That is normal. And what each person does is tailored to their own body. You adjust it to yourself like you're essentially seasoning a pot of soup. If your bowel movements feel good, you're emptying every day, you're not bloated, you're doing it right. Now, people often get labeled irritable bowel. The trick about irritable bowel is it's a way overused term. Some people just throw it out. Essentially, when I hear irritable bowel, I hear, I don't know what your diagnosis is, so I called you irritable bowel. Realistically, if you haven't had trouble with your bowels your whole life, you don't have irritable bowel. Irritable bowel is something starts right after puberty and just gets worse. Now, that doesn't mean your bowel can't be irritable. Yeah, your bowels can be irritable for a lot of reasons, but that doesn't mean you have irritable bowel syndrome. And the key thing is to try to identify what is making your bowels irregular and making you unhappy. You can go on.
Okay.
Yeah. So the number one thing that people often forget is, and especially people from Wisconsin or a dairy state, is cow milk is bad. Bad cow. Cows have horns for a reason. They're evil. At least generally most of us in the GI tract think that way. Why? As we get older, everybody becomes milk intolerant of some sort. And certain things will make you more milk intolerant and accelerate the process. If you had to go through chemo, it's caused your lining to adjust, caused your bacteria to adjust. If you get bacterial overgrowth for some reason, which we're going to talk a bit more in a moment, if you get an infection, any of these things will bring out the general progression of milk intolerance. One of the things people often forget, though, is it's not just the lactose. You can actually get an allergic reaction to cow milk. And one of the most common causes of non-bloody, persistent diarrhea, persistent soft stools is microscopic colitis. And the cow milk literally triggers an allergic reaction. And we can see the cells. When we go in and look in your colon, we take a sample of skin, we see the white blood cells just cruising on in there to fight what you're eating and what you're putting in your body. And the number one cause is almost always cow milk. The interesting thing about it, though, is cow milk is a separate category. So people who often have trouble with cow milk, if they switch over to a goat or sheep milk product, we're talking goat or sheep milk cheese, goat or sheep milk yogurt, they'll often do fine for many years. Later on, they may have more trouble, but most people can get away with a goat or sheep or a non-animal product. And the key thing, the message there is not all milk is the same. And you're seasoning to your body's taste. But if you think you're getting bloaty from milk or you're getting loose stools, switch over to goat or sheep. See if it feels better. Switch to a non-milk product and see what happens.
Will you be talking about leaky
Oh yeah,
soon? Okay.
We're going to cover all of leaky bowel and diverticulosis and such. Okay. So, but we're going to get the groundwork underway. Now, when people say, "Well, what about gluten?" You know, I'm got gluten intolerance. Well, gluten intolerance, yes, is common, but gluten intolerance does not mean gluten allergy. Gluten allergy is, again, the white blood cells. Like we said, cow milk causes it. Gluten can cause white blood cells to come into your intestine as well. To have a gluten allergy, you need to mount an antibody in your blood. You have to show the reaction. Now, but people say, I take gluten, I don't feel good. Well, you got to understand, gluten is sand. So you're back to your kitchen sink again. You're pouring sand down your plumbing every time you have gluten. So if you're not running a lot of water through, of course the sand's going to clog your plumbing. And it's going to bring out more gas. It's going to cause more bloating. It's going to sometimes make your constipation worse, or it could make some other. So just because gluten makes you unhappy doesn't mean you're allergic to it. But eliminating it, if it feels good, comes back to the basics, which is season to taste. If you want your bowels to feel good, gluten's not your thing, then limit it. The reason I make this point, though, is if you're not truly allergic and you have a little bit of gluten in a cookie, okay, drink a lot of water because it's sand. Wash it out. Don't feel like you have to buy $5 Oreos. I mean, a true elimination of gluten from your diet completely should be for those people who are truly mounting an immune response. Now, the other aspect is, as we all get older, is to realize that things completely unrelated to what we're eating can affect your GI motility. Thyroid problems, overactive thyroid, low active thyroid, it's going to affect your motility pattern and manifest as GI issues. So people often are focused on their GI and forgetting that maybe they didn't take their thyroid replacement. Maybe their thyroid tests have been a little out of whack and they never really addressed it. So this one is to remind you, if you have other medical conditions, they can directly affect your motility separate from what you're eating or doing. And when we come back to fiber, now this is, you go everywhere, fiber, 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 fiber. You got to have fiber. You got to have fiber cereal. You got to have salad. You got to have this. People have been pushing that at us so much that it's sort of gone way overboard. Fiber in the diet, yeah, that's good. Excess fiber, it's not. And fiber in a young person, great. Yeah, nice narrow colon, straight shot, boom, goes right on through. Fiber in people who are over 50, not so much. I mean, it's clogging things up. The plumbing's not a straight pipe anymore. It's often twisted from surgeries or diverticulosis, which we'll talk about in a minute. And fiber is a bulk laxative. If you've got a lot of poop and you're trying to push it out and you take a bulk laxative, too much of it, you're making more poop. You're making your job harder. So with any time you're relying on fiber, you've got to not forget the water. Sink at home. You're shoving a whole bunch of lettuce leaves down the old sink. You're turning the faucet on. Nobody's going to shove a whole bunch of lettuce or grains and rice down your sink and just let it sit there. So you better be running the water through the plumbing if you're relying on fiber, and don't make your job harder. Gas and bloat. Coming back again to the ideas. We talked about the clog in plumbing. And when you clog the plumbing with too much material, it's not coming through, then gas is going to form above it. Gas and bloating is usually not so much the diet, but the fact that you're not clearing the material in your diet or you're eating it the wrong way. Now, I put a list, though, of obviously the foods and things that will increase the air, but the air is forming behind a clog. And if you fart all that air out every day, you could probably get away with gas formers in your diet. It's a balance. But if you're talking about your big gas formers, you're saying, okay, what can I eliminate to knock out 50% of my gas so I can get away with some of the other things? Number one, top of the list is bad cow milk. That one is the big gas former. You eliminate that, you get away with the other ones. Maybe not a lot, but you get away with it. And so if you're looking for the one thing to cut down on your gas, focus on the cow milk usually. And you got to also understand, when you're taking your fiber, your vegetables, if they're cooked, they're going to make less gas than if they're raw. And so a raw salad's going to make you more gassy than soup potentially. So when you're running that gas issue, you start to think, maybe I should be on the other side of the equation. And we all know that the foods that everybody associates with gas: beans, onions, celery. Some things, though, people forget: peas, apples, especially raw apples. You're better with applesauce than apples. Apricots, bananas. Some of the things that people don't realize: gum chewing. Gum has sorbitol. Sorbitol, it makes gas. People who chew a lot, they swallow air and they get a lot of gas from the gum. Smoking, the CPAP air swallowing. Those are things that you have to take into consideration that may be adding air to you. And then the obvious: you're drinking the air. And that's where the sodas come in, diet or otherwise, beer, anything with bubbles in it. You're putting air in your stomach, so you're making your job harder. Now, people have a lot of questions about diverticulosis. Now, the diverticulosis and the how this fits into the whole pictures, doctors don't explain to you, how did I get them? Well, diverticulosis, if you look at these pictures, these arrows are pointing at little pockets in the wall of your colon. Think of them like the pores on your face. And they are just dilated, deep little pockets, pores in your intestine. And when you're getting diverticulitis, you're getting essentially zits in the colon. And you can get bad acne with big, pussy sores in your colon from the same way you get it on your face. If you put a facial scrub on, think fiber for the colon, and you don't wash it off, you're going to be in problem. That's why we're talking about be careful about lack of water when we're overloading with fiber. And we need to obviously flush the area and move things through. These pockets are forming, though, from high pressure. So when you're going to the bathroom, but you're not emptying and you're retaining that bloating over a lifetime, you're putting pressure on the wall of the colon, and it makes these pockets. It makes your pores bigger and makes it more likely that something will get stuck in them. So that's where we come back to going, but feeling empty. That's the mantra. Go, but you want to feel like you emptied it, all the air came out, and ergo, even if you've already formed the diverticulosis, you're going to deflate the pockets. You'll make your pores smaller and make your job easier.
What does the poop look like if you have the diverticulosis?
That's where you get the little balls. So people say, well, I pass these little balls first, or I pass a poop that looks like it's a whole bunch of little balls stuck together. Those are the poop forming up in those pores. If your bowels are moving through smoother, the more smoother and more efficient, then they don't have time to push out those pockets and form the holes. And so they start to smooth out. From a GI perspective, we don't really mind if your stool comes out as a cow patty, as long as it comes out. And the idea is full evacuation. And I tell my patients, and I say, look, if you're not leaking and you're not in pain and you're passing a soft, mushy stool 1 or 2 times a day and feel good, that's great. That's what we're looking for. It doesn't have to be classically formed up like a log. A matter of fact, more times that it's formed up as a log, you've got a tighter seal and you're keeping the air in and not fully evacuating. So the principle for us is obviously evacuation without leakage, without pain, without bleeding, and trying to avoid getting too many of those little balls, which show that you're retaining. And when you talk about the color of the stool, the darker the stool, the longer it's been there. Putting all ideas of blood aside and such. But general rule, if your stool is really, really dark, that means you've been holding on to it a while. Now, some people were asking about leaky gut. Again, leaky gut has gotten all over the place. There is leaky gut, but leaky gut does not leak without a reason. The bowel has a good system and it has a good seal, but sometimes the seal can get broken or worn out, but it has to have a reason almost always. And most of the time, it's some inflammation infiltrating the bowel. And that comes back to cow milk allergy, celiac sprue, gluten allergy, inflammation of the bowel, and inflammatory bowel disease. That may break down your barrier. But most people do not have leaky gut who are otherwise with an intact immune system and without other conditions. And if you're going to get that diagnosis, you really need to see a gastroenterologist and have them review your intestines, show you the process why your gut is leaking before you run down that road. And then you talk about bacterial overgrowth, which is the other really common one. Again, the bowel does not get overgrown without a reason. If you're not dealing with altered anatomy, somebody hasn't cut your bowel and made scar tissue where things get clogged up, whether it be a small bowel obstruction, whether it be a resection for, let's say, a colon resection for a cancer or diverticulitis, there's not going to be stasis. Stasis meaning slow flow. Just like in your plumbing, if the water doesn't flow through in your sewage system, you get bacterial overgrowth. If you don't have altered anatomy where stasis can occur, you're not going to generally get bacterial overgrowth. Now, you can also have those slow flow without altered anatomy. Think narcotics, diabetes, in situations where things might go slow flow. But in general, in a normal bowel with a normal flow situation, you're not going to get overgrowth unless you add in some other factor. And the other factors might be something like an immune deficiency, where you're not able to fight your bacteria, or you might have decreased acid production, atrophic gastritis. But the final message is the same as the first. Bacterial overgrowth does not tend to happen in normal bowels. It usually requires some alteration to allow a low flow state. And when you come back to treating, if you're concerned about bacterial overgrowth, go back to the same plumbing idea. Get the water flowing, get your evacuation going. If you want to clean out a pipe that's all grown over with sludge, you take the hose and you run it through the pipe and you wash it out. That's the most effective treatment. And yeah, you could add a probiotic or something like that, to make it smell nice. But the idea is water is still your best friend.
Would some surgery like a tummy tuck or something else that's
No, it has to cut the bowel. A tummy tuck isn't going to do it. You have to adjust the plumbing. So if you're, redoing the wall outside of your plumbing's still intact. It's flowing fine. You can make the wall as pretty as you want. You can also work on other things in the kitchen. But if you're not changing your actual plumbing structure, then you're unlikely to have trouble with your flow through the plumbing. And when we come back to harping again, you want regular bowels, hydrate. Fiber is good, but hydration is the most important. Now, when people talk hydration, it comes down to stool softeners. And people are going, well, when do I use stool softeners? Why should I use stool softeners? Stool softeners are different than laxatives. People, they fall under the category, but there's an irritant laxative, and that's where somebody's taking a big stick and saying, I want you to carry this across the room. I'm going to hit you with this stick until you do it. Yeah, that's not a great idea. Irritable laxatives are not a very good thing to do all the time, and that's the Senna or something like that. Now, an osmotic laxative, that's the hose washing out the pipe. Water is not going to do any problem. It's just going to wash things free. And things like Miralax, and you could do a pill form, but Miralax, the powder, is very useful because you can adjust it to yourself. And it holds this water that you're drinking so you don't swell up your ankles. You don't pee all day. It holds the water you're putting into your body in the plumbing so it washes it out to your satisfaction. And being a powder, you can adjust it to your liking. You can get the frequency, you can get the evacuation on time the way you want. So when you are hydrating, use of any form of stool softener, again, the softener aspect, like Miralax, which is an osmotic process, is going to be far more useful to you. The other factor about it is you can time it. And people often say, well, I don't want to go all day. Well, Miralax is used by neurosurgeons, pilots, teachers, because once they figure it out, they know they take it at 5 in the evening, they're going to release their bowel right when they wake up. They stand up to go pee and they poop right in the morning, take their shower, and they're off for their day. Or they'll take some in the evening for the morning bowel movement and some in the morning, so they'll poop after work before they go to bed because they don't want to go to bed and be bloaty all night. Miralax can be timed. You have to figure out your dose, adjust the amount, when exactly you take it to get the results you want. But it's completely under your control. And there's no such thing as too much. Too much, you get diarrhea. Okay, I overshot. Too little, it doesn't work. So the idea is when you're hydrating, use your stool softeners to make the hydration more effective. And don't be afraid of it. And you'll soon discover that you can train your bowel to go when you want, on command, so that it'll evacuate and you won't have that fear of being out to the store and, oh, I got to find a bathroom. Now, the other aspect when you're using a stool softener hydration is people say, well, I took it and I started to blow up like a balloon and I had a reaction to it. No, what you did is you built up pressure behind the cork in the bottom and you're trying to push the cork out the bottom. Once you got the cork out, the Miralax will keep things flowing. And often people will start the stool softener hydration thing after their colonoscopy, after we've washed everything out of the colon. Then it's empty. There is no cork to push out and they don't have that trouble. But if you're feeling like there's a plug in there and you're building up pressure, take a lot of it. Don't go anywhere that day. Take a lot of Miralax. Do your own cleanse. Wash the cork out of the bottle, then set your dose. Then you'll have a much easier time. But if you creep up on it, yeah, the pressure's going to build up. Just like the Drano commercial, pressure's going to build up till the clog in the pipe goes out.
What about Citrusel or Metamucil or other
Well,
fibers?
Citrusel, we'll see, that's back to the thing. Fiber in the diet's good. Extra fiber isn't. You can adjust fiber. You can add as much in, but I'd much rather you have fiber in your food than take Citrusel and Metamucil, because you want to eat fun food. If you're taking Citrusel, you're making your job harder, because then you got to be careful about too much fiber between your food and your supplement. So you have to be careful with how much supplements you use, because you've got to drink enough water to get them out. Citrusel, Metamucil, fiber products are bulk laxatives. That means they soak up your water, they expand in your colon, and that's how they make you poop. It's a mental thing. You see the poop come out and say, hey, my fiber made me poop. Yeah, but it made you poop by filling your entire pipe up with poop, as opposed to water, which is washing your pipe out. And when your pipe is young, no big deal, in and out. But when you're older and your pipe is longer and twisty and it's filled from one end to the other, you're going to be heavier, bloatier. And many people say, I take fiber and I get a bowel movement. I just feel heavy. I feel pregnant. It's because you're filling your whole pipe up to achieve your bowel movement. And that creates stress on your diverticulosis. It can trigger diverticulitis in some people if you're retaining too much in those pockets all the time and not cleaning them out.
And how many bowel movements is like too many in a day?
There is no such thing per se as too many if it feels good. But what we aim for is 1 to 2. And I tell people, if you're having 4 formed stools a day, your pipe's full. And you should probably use the stool softener, adjust it up, and your volume will go down. People say, well, I'm going to go more and more and more. I says, no, I do colonoscopies. If I give you enough, eventually you're going to get empty. And if it's formed poop and you take enough, you're going to empty. And then it's a matter of keeping it from refilling. So there's a lot of difference between frequent bowel movements that are water, diarrhea, and frequent bowel movements which are soft formed, mush, or formed. Very often, 4 soft formed, mushy, or formed stools means you're full. And you can be full of mush, you can be full of sand, but you're still full. And you'll get less bowel movements sometimes by using Miralax or a increased hydration. And we'll talk about other non-pharmacologic ways to make your bowels move better. And you can actually reduce that frequency to a more manageable level by understanding how you're getting those bowel movements, why you're getting those bowel movements, and tailoring your treatment for that. One size definitely does not fit all. So moving right into our next thing, how do I achieve regular bowels? What's the best diet? We want water, almost always. Now, your doctor may have other issues with water, but for your bowel, we like water. And so if we have fiber in our diet and such, we want water with it. So people who aren't getting the bowels they want, soup is always better than salad. Soup is lovely for the GI tract. A little bit of warm water with your fiber and your other foods, it's going to flush it through, less you have to drink. Life is good. When you're talking about your vegetables, cooked vegetables are better than raw. If you cook your vegetables, they're partly broken down. Your GI tract says, great, less work for me, and I can finish the job and get into process. Your fiber's in a more processable form to get it out. When you talk about meat, chicken and fish is better than red meat. We're talking Mediterranean diet here, of course. The red meat is heavy. It's difficult to chew. It makes gas. So different protein sources like chicken and fish tend to be processed easier. They pass through easier. Your GI tract is happy. And when it comes to milk, cow is evil. We keep coming back to it. Cow is evil. It tends to be the most gas forming. It tends to cause the most allergic reactions in your GI tract. Goat and sheep seem to go through better. And then you got to watch out for the extra fiber. And when we think about, let's say, nuts, seeds, and popcorn, to me, those are rocks. So you're taking a whole bunch of rocks and you're just throwing it down your plumbing. You better put a lot of water, because if you're throwing a whole bunch of rocks down the plumbing, of course, it's going to clog again. You can chew them all day, but then you're just back to sand again. Putting sand down your plumbing is still a bad idea as well. So yes, nuts, seeds, great. They are good for your diet in moderation. But if you're taking handfuls of nuts every night, you're making your job harder. You better be hydrating, and you better be thinking about Miralax if you're having bloating and trouble moving your bowels.
I think the next time if we give this talk, you're going to say cow is sacred.
Yeah, Hindu, yes. Sacred, that means we should never touch it. So the other aspect of, we said, okay, we've been talking about diet. We've been talking about, Miralax and products. But don't forget also that exercise. Now, when we're talking exercise, it's really come into vogue now, and it's really must be emphasized. Anybody over 50 needs to swim. If you can get in a pool, that's going to make everything better. Studies show swimming will drop your arthritis 30%. They'll drop your need for arthritis medicines 30%. Being in the water is a weightless environment. It improves your overall body function, your motility. But the trick is, even if you just take a kickboarding kick, I mean, not even, most of us, our shoulders are bad by, 50. We've already damaged or something. So even just holding a kickboard and kicking our legs will make your bowels better. And most people who swim are honest. They're jet propelled. You're going to be farting after a couple of laps. Air is going to be going out. And when you get out, you're going to feel, hey, I got to go pee. I probably got to go poop. Because the movement of swimming, the rotating of your hips, is actually pushing the bowel in a gentle way to help it do its job. And that can't be underestimated. The other thing is, when you are horizontal in the water, your pelvic floor is able to float up. Most people are having pelvic floor problems. Maybe they've had pelvic surgery. Men are prostate, women hysterectomies. Your pelvic floor, childbirth, is weak. So in swimming, your pelvic floor is able to rise and fall much easier. And with the rotation, you're going to strengthen your overall function, release any scar tissue that may be in there, and really significant benefit will occur all around. Now, if you can't get in the water, yoga is an option. Now, look at your picture of the yoga guy, though. He's twisting his stomach. That's our yoga. You can do yoga for everything else, your back. But for GI, we want the twist. Do the twist. Even if you're doing chair yoga, turning side to side, because you're taking the turns of your colon, you're straightening them and releasing them, straightening, releasing them. So anything that can rotate your abdomen is going to help your movements. And focusing in also on Kegels. People forget that Kegels are great. But when we're talking Kegels, everybody thinks, well, women, childbirth. I'm done. Had my baby, did it for a year, done. No. Kegels is part of strengthening your pelvic floor. And when we're talking about Kegels for men or women, what we're not talking about is tightening your leg muscles or zipping your butt cheeks. That's not going to make a hill of beans difference for moving your bowels or moving your urine. You need to be talking about the muscles right where the urine comes out. And the perineal muscles, and guys, tightening those muscles makes a difference too. And the idea is that will help to strengthen the movement through the perineal area and help you evacuate. Now, we talk about the exercises, we talk about the rotations, the strengthening, and also realize when things have dropped, when you're trying to achieve a regular bowel beyond exercise, angles matter. And that's where the squatty potty comes in. You may notice that lifting your leg when you're trying to move your bowels makes a difference. It's not your imagination. You're straightening things out. You're allowing for the angles to be smoother so things will slide out. But all of these in combination, don't forget your mechanics. Now, that was a quick run through of everything. And as like all GI doctors, I'll talk your ear off on anything GI related. And so the questions are open. You throw anything out, I'll be glad to talk as long as you guys want to listen.
Well, the first question is what is the recommended daily amount of water?
Generally, again, this is a seasoning to taste. Most people talk about 2 liters of water a day. But from my perspective, not being a critical care doctor like my wife and not being a cardiologist, there is no such thing as too much water. The idea is, as long as your legs aren't swelling, you're going to do fine. The idea, though, is you don't want to pee all day. And that's where you're trying to find the balance. And you want to hydrate as much as you can without triggering too much peeing, without triggering too much swelling. But if you're having trouble balancing that need, that's where you use a stool softener, where you preserve that moisture for your colon, so it goes out with your poop and allows you to take in more hydration. The thing is that bowel issues are often seasonal. If you're going in a hot climate, if you're going in an airplane, if you're using a lot of air conditioning, it's going to suck your moisture out. And a lot of times, skinny people have the hardest time of all hydrating. They drink, 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 but it goes right out through their pores. And they just lose it all in insensible losses. So again, each body is different. You have to adjust the amount you need. And sometimes you have to help your body send the water where you want it to go.
And then squatty potty, that's a new one for me. What is that?
Squatty potty is a stool. You'll see them sold on the internet a lot of times. And people, sometimes they're embarrassed to talk about it. But the idea is the movement of your bowels requires a change in the angle of the colon when you go to evacuate. When you're sitting on the toilet, the actual position your body assumes affects whether the bowels will be able to evacuate easily. And so the squatty potty will often raise the legs a little bit and shift the pelvic floor angles to straighten the colon and allow things to flow out smoother. But there's also sometimes some herniation of the colon. That's what they call a rectocele. And so by straightening, things will flow out. Now, there are people, and they don't tell you in mixed company, but have to put pressure down next to the opening to get their bowel to come out. Some women have to put their finger in their vagina and push to straighten out their rectum to allow the stool to go out. That's what we're talking about. The mechanics, we often have to achieve the optimal, the best angle for the individual to get their bowels to come out. And if somebody has a bad angle, softening the stool allows it to get around the turn easier. And that's why people say, well, I should have a nice formed up stool. Not everybody. If you have a herniation, a rectocele, and somebody's been pushing fiber at you, you may be bulging that wall out more. And you may want to reduce the fiber and increase the water and the stool softener so the stool won't be able to generate pressure to make the herniation, make the angle worse, and allow the stool to slide out easier against resistance.
How about oat milk or almond milk instead of the dairy?
They're fine. Non-animal milks are fine as long as you're not having any GI intolerance to the product that it's made of. And that's where sometimes, there's questions about soy and people who've had breast cancer and all. Those are questions you would put to your doctor about what's your choice. But coconut milk, oat milk, wonderful. I always come back, though, to remind people that middle ground of goat and sheep, don't underestimate it. People say, oh, it's going to taste goaty. It's going to be like feta. No, Costco sells cheddar cheese made from sheep milk. You have to ask your particular Costco, but my sister gets big rinds of it. They have sandwich slices that taste the same as any other cheese. That's what I use. Yogurt, true good Greek yogurt is made from sheep. Most Mediterranean cheeses are made from sheep or goat. We have a bias in America towards cow milk, but that was a marketing thing. The cow milk is cheap, readily accessible. It doesn't mean it's the best form of cheese, and there is variety. So I encourage people to try different things. See, experiment a little bit. And they even have bottled sheep and goat milk at some good stores that you can use to make a cream sauce. I get pizzas at Pizza Nova made with goat cheese and a nice little bit of bacon. My wife doesn't like that part, but hey, I'm grandson of a butcher. What can I say? But tastes great. No gas, no heartburn that night, and it's a pizza. And you can have your pizza next to everybody else. They can't tell. So the idea is don't be afraid to get creative. Test your own body.
Nocturnal leg cramps and hydration. Does that reflect dehydration?
Not necessarily. The idea, and that one falls actually more into the lines of your internist in critical care, but we do feel that salts make a difference from our standpoint. And I don't mind bananas so much for that kind of thing. We actually still advocate tonic water. I know we're a little bit of dinosaurs in the GI, in most of us, but hydration and salt balance are two different things. And most of the time, leg cramps in our mind is some imbalance in your mineral salt content. But there's one codicil, back to the swimming. People who swim and really swim don't get as many leg cramps because you're stretching out the muscles. It comes under that codicil of what they're saying. The studies of 30% less joint pain. It's actually 30% less muscle and joint pain, 30% less muscle spasm, 30% less medications to control it. If you're stretching those muscles out, they're going to spasm less. And that's where we actually put most of our emphasis is stretch them, get them loose, and you'll do better.
And then, what kind of water do you recommend? Warm water or cold water? I
Ah,
know the Ayurvedic, we advocate for warm water to help
warm
the
water is
digestion.
your best friend because warm relaxes. If you're trying to swallow a pill, for instance, you're better to do it with warm water or lukewarm. The studies in GI are quite clear. They did studies and they said, okay, let's look at somebody who swallowed food. How do we get that food out of the esophagus? How do we keep them from refluxing? Short of medicine. And this is back old in the dinosaur days when I practiced with Fred Flintstone, but this is the idea is they actually took an x-ray, had people swallow, and then compared warm versus cold. Warm, even in somebody who's 90 and has no muscle contractions left, because as we get older, our esophagus just stops contracting. The contact of warm to the GI tract initiates normal swallowing, even in an esophagus that doesn't get connected to any other nerves anymore. And that's the whole GI tract. Warmth and warm water will make your bowels move forward naturally without medicines. Cold makes it spasm. You take something cold, it makes the holes smaller, makes it harder for you to get the pill down the hole because all of a sudden you're trying to thread a needle that's got a tiny little eye versus a big eye that you can just pass it right through. So we always advocate warm over cold, especially anybody who has motility issues.
And then, can a rectocele result in a wide bowel movement?
No, the rectocele is more along the lines of think funnel. The rectocele makes the top of the funnel wider, and then you're aiming through the little narrow hole at the bottom. If you have a wide bowel movement, that's often due to sphincter problems. The sphincter itself is not tightening. And as we get older, we have trouble getting a tight seal. That's part of what the Kegels are doing. You're trying to exercise your sphincter to give it strength. But our sphincter doesn't hold against pressure as we get older anyway. And a wide stool is usually a sign your sphincter is relaxing too much. The idea, though, of the top of the funnel, the other thing to think about is if your stool comes out really narrow, sometimes it's a Play-Doh machine. You've got all of this stool coming through the narrow hole and you're pushing it out and it's coming out in a little ribbon or a little turn. Often that's the case. You've got too much trying to get through a narrow space. And what you're trying to do is get that sphincter to relax enough when you want it to let everything out easy, and then tighten up when you need it to hold it in so you're not having leakage. And when it comes to leakage, too much gas will cause leakage. And so if your sphincter is dealing with a lot of pressure, when it feels a need to let a little fart go, if it's going to let a little poop go, or it's going to, if you have a little too much water along the side of your stool, it's going to leak out at that time. And so the idea there is if you fully evacuate on your schedule, then if you let a little air go and your sphincter gets a little bit more mobility, you're not going to have a leakage and you're going to be able to decompress more effectively and keep the rectocele from bowing out too much into your vagina or pushing on your bladder.
Now, this is a big question. What is colitis and what causes it?
Colitis is a rash. So thinking back on your skin on the outside, all colitis is a rash. Looks like a rash, acts like a rash, it's a rash. And it's caused by the same way you get a rash anywhere else in your body. You can get a rash from an allergy to milk, allergy to gluten. You can get a rash from immune causes. You can have, ulcerative colitis, where your body doesn't recognize your colon anymore. You can get a rash from infections, diverticulitis. When you infect your colon, the wall becomes inflamed all around it. You can, get poor blood flow to your bowel, and it'll get colitis and a rash. because it's inflaming itself because it's starved of oxygen. So the idea is, when colitis is a general term, all it means is inflamed bowel, a rash of some sort.
And our last comment, and it's a great one to conclude on, is that somebody said that they'd learned more in the last 30 minutes about their GI tract than they have in a long, long time. And I think that's a great note to end this session on. Thank you so much for your time and preparing this education. And look at all the people clapping. So we're really honored. And any other questions you all have, let me know and I'll pass it on to my husband. When we used to be in training together and get calls at midnight or 2 in the morning from the ICU and they'd ask for a GI consult, I'd just hand the phone over and we will do that for you as well. So
Certainly.
thank you very, very much.
Thank you all for your time.
Take care.